Hello, this is Dr. Michael Gott. I'm an orthopedic surgeon at Westchester Health Orthopedics and Sports Medicine. Like we've done the last few weeks, again we're going to highlight another injury from the NFL which may be affecting your fantasy team. If you own LeSean McCoy or now Marshawn Lynch, you know that they both have hamstring injuries. And when a player has a hamstring injury, this is probably one of the hardest injuries to prognosticate, to find out when they're going to be able to come back. If you don't know, the hamstring muscle is in the back of the thigh. It is a series of three major muscles that helps to flex the knee. The largest one being the biceps femoris, which lives on the outside of the thigh and attaches to the fibula, which is on the outside of the knee. The semimembranosus and semitendinosus are on the inside. Now, all three of these muscles are injured in about equal amounts or equal rates. In order to prognosticate this, something that we've done recently with some of the higher level professional and college players are to obtain MRIs of these injuries. In the past, we really wouldn't have that much information. We would look for bruising, and bruising would actually see if it was torn or not, because whenever things are bruised, that means they're bleeding, and they actually had a real injury. If it was just a grade 1 or a strain or stretching of the muscles, you usually don't get that. Now, with the power of MRI, we are able to prognosticate. Now, with these NFL players, we don't actually have the MRIs of the legs to be able to see how bad the injury is, nor do the teams give us that information. But we can get some information if they have an MRI or not. One study that was done looking at NFL players, which was done most recently, which was in Sports Health, looked at 39 different NFL players over a period of 12 years. And what they did with these 39 players is they obtained MRIs of their hamstring. Now, this wasn't common practice when they were obtaining this data, but in those players that they obtained MRIs in, the average return to play was 2.6 to 3.1 games. Now, depending on the severity of the injury, and they did a grading scale, 1 through 3, depending on how bad it was, the worst, of course, took longer to get back, which was about 5 games. Now, when you're thinking about LeSean McCoy, who has a hamstring injury, who now had to have an MRI done, we could prognosticate that it's going to take at least 3 to 4 weeks for him to come back. And that's because he missed one game without the MRI. Then they performed one and found that there was significant damage. And now they're saying he's out probably 3 weeks. I agree with this. So if you have LeSean McCoy on your team, I would go ahead and pick up Carlos Williams as backup, because you know if he had an MRI, his hamstring injury is significant.